So welcome, Amani and Abdullah, to our Emerging Leaders Network. As I'm sure you've seen in the emails, these meetings generally occur once a month on the second Wednesday of the month at this time, so 5 p.m. EDT. And myself and Gertrude are the co-leaders of the Emerging Leaders Network. I think Gertrude will be stepping back a little bit in a few weeks as she's taken on a new role, which I'll let her explain a little bit. I'm super jealous of her work, but in the future it'll just be me, and then we'll be looking for someone else who might be able to and willing to help with that. And we also have Inasa, or Innocence, helping out as kind of like a mentor advisor. As well as Neil, who's the director of Pegasus Institute, which I talked about a lot at the MPH Career Day, and Camille, who's also online, who is the events coordinator planner for Pegasus as well. Melissa, the executive director of Pegasus, will be joining, but she told me that she will be a few minutes late. And so yeah, so I'm not sure what else to say to introduce. I'll let Neil, if he's online. I'm not sure if he's he might be in the car or something, because he does that. He's very busy and moves around a lot, so often he joins us from various places. But I'll let him introduce Pegasus if he's online. But if not, I will continue and detail a little bit more. Neil, are you with us? Sounds like I'm in a seance of some sort.
He is, but he has no mic. So, okay. Maybe we can get started. Maybe Innocent, if you'd like to introduce yourself.
Very briefly, I'm a member of the Pegasus Advisory Board. And I'm here in my capacity, as Chloe said, of maybe advising advising capacity. So thank you for this opportunity again to really listen. And I said I will be listening into the discussions today and learn from you. And if I may, I will also contribute as much as I can.
Thank you, Innocent. Since we have new members, maybe it may warrant just doing an intro slides. But before we do that, my name is Gertrude, part of the board of directors in Pegasus Institute, and as part of my role, Chloe and I, as she has mentioned, we were spearheading the Emerging Leaders Network. So a little bit, I'm not sure how versed you are with the Canadian landscape and how kind of global health is mapped out here in Canada. But there's various organizations, Canadian Coalition, Canadian Society, that has now merged together. And ours is a little different in that it looks at the sustainability aspect and the peace and security versus most just look at the global health aspect. And maybe Neil can give us a quick background of how Pegasus Institute came to be, but a quick synopsis. It used to be a conference held by the Seeley School of Arts in Kitchener-Waterloo, and it would bring in various thought leaders in various aspects under those themes. So security, peace, security, let me actually say them right. Peace, health, and sustainability. And it used to be, I believe, is it every 2 years, Neil? He might give a better one. And during COVID, it was a year that we were supposed to host another one here in Canada. And of course, with COVID, that didn't go through. But a lot of our members were asking that they wanted to keep the coalition going and continue the engagement across researchers and thought leaders across the world. And so what we had in turn done in response to that is to try and make it an NGO in Canada. And with that, we saw kind of two needs. There's a need of people quite deep into their professions, and they're looking at more so for networking and sharing opportunities. But there's also the subset, which is us, who are kind of new to our careers. And so in response to that, we, through Neil's encouragement, decided to do an Emerging Leaders Network in which kind of a lower cadre or kind of emerging leaders are setting foot in the world. And so the way we have decided to run Emerging Leaders, which is a little bit different from other organizations, is that every meeting, instead of you guys just coming and, listening to what we're talking about, or, we're just pushing information to you, we decided to make each meeting kind of a value add to your day. And so in doing that, we are engaging with the leaders in the management of Pegasus in order to kind of share their experiences and build networks amongst the emerging leaders. And so what we're doing is something every month we try to get a presentation or something that we think is relevant to our population, and kind of pass on some suggestions or thoughts on those. And so at the end of this, if you have time, I'll put in 2 or 3 people. I may put them in now. They have already volunteered for at some point this year, hopefully in the next month or so, to do a presentation. But of course, with 20 years, 30 years, 40 years careers, they have a lot that they could talk about. And so something that Chloe and I were helping them is to kind of narrow down on some topics. So in the interim, I can put the names on of the few people at the bottom. And if you have a chance, maybe during the meeting or after, you can peruse kind of their background and see, and maybe suggest some topics that they would be able to provide. So maybe I can put that in, or maybe Chloe, can you just put this in from that? And if Neil would like me to go ahead, I can do my presentation. So I decided to do a presentation of transitioning from kind of a student in the capacities that we do have, and through the internships that I know all of us are suffering through or will suffer through, in order to get kind of a career in global health. And during COVID-19, I was fortunate enough to get a placement with WHO. As Chloe mentioned, I'm in my capacity. I'm just phasing out of the capacity, and I'll be moving to Tanzania for 8 months as a partnership fellow under Aga Khan. And so I'm hoping, at least in my presentation, what my hope was to just kind of walk through what I did and kind of the resources that I've gathered throughout that process, and maybe it's helpful, and I can share my contact, and you guys are free to get in touch with me. Just to mention, before this capacity, the organization Canadian Coalition of Global Health Research, I was executive board for the Student and Young fellow, they were calling it Student and Young Professionals arm. And so I've thought a lot about this in terms of engaging students and engaging researchers in global health and how they fit in the Canadian landscape. So hopefully this presentation is helpful. But before I get started, maybe I'll give Neil, if you would like to say 1 or 2 things, and then I can get started, and then Melissa can close in. Neil, please go ahead.
Sure. I'll just really try to be brief. Thanks for the introduction, and really nice to have some people from Western MPH after Chloe went to speak. The roots of Pegasus actually began when I directed the Global Health Office at Western. And we had a conference called Transcending Borders, which looked at global health, international and local, at its intersection with sustainability. Then some of us, not really associated with Balsillie or any particular school, decided that we might have a conference that would continue, also including peace, because we had a number of connections with various NGOs, as well as policy people, students. And so we had conferences every 2 years in Toronto, and we're planning one at Balsillie School in Kitchener. So you, in terms of being part of this, you will be able to meet with a very transdisciplinary group of people from environmental studies, peace studies, academics, researchers, policymakers, advocacy people. So it is really rather exciting, and the Emerging Leaders Network is very important to us. We also have a Francophone network looking primarily at Francophone African issues that Chloe leads, and a Latin American network. And the Latin American network has webinars a couple of times a month in Spanish with leadership from many of those countries. And then we've got some events like our Summer Institute, which is going to be later in the month with McGill University. And we'll have two courses, basically the mornings in North America time, the week of May the 24th on Peace Through Health, and the week of June 6th on environmental health. So yeah, and then later in the summer, we'll have an event on Wolf Island near Kingston where we'll concentrate a bit on some Pegasus issues, but also on refugees. So we've got a group of young musicians, Indigenous and refugee, that we hope will be mentored by different musicians. And so we've got Indigenous musicians, a Palestinian oud player, and then some somewhat well-known Canadian musicians. And then we'll have another section with refugee health professionals, people who are trying to get into the system in Canada. So we'll have some activities for them in terms of careers in Canada. Some of them actually choose to do things like MPHs like you're doing, or trying to practice in their own field. So that's just a brief introduction, and I will be quiet from here and let the rest take over, but nice to see a few new faces.
Thank you, Neil. If I may, then I will start my presentation.
Really quick, Gertrude,
go ahead.
I'm wondering, apologies for interrupting. I'm wondering if we can hear just a quick introduction from our new participants, as I'm interested in hearing a little bit more about their background, if they're open to doing that. So I'll start just to my right. So Abdullah, go for it.
Perfect, thank you. Hi, everyone. Very good to be here. My name is Abdullah, and I'm a student at Western doing a Master's of Public Health. I used to go to McMaster University. I graduated last year, and I did an honors life sciences degree. The reason that I'm interested in this is because Chloe came in Careers Day and spoke about it, and I've done some research before with newcomers. Specifically, I created a guide with McMaster Research Hub about inclusive and meaningful research with Hamilton newcomers, along with an outcomes evaluation for a sports activity program that was intended for Black students in Hamilton, and also a research project about businesses in Hamilton and how street closures affect them. So in general, I'm interested in research and interested in global health because I'm doing a Master's of Public Health. So I thought I'd check out the Pegasus Institute to see what it's all about. Very happy to be here today. Thank you so much.
Awesome, thank you, Abdullah. We'll go to, and I apologize if I don't pronounce your name correctly, and feel free to correct me. Zinyi.
Hi, my name is Xinyi. I'm also a PhD student at Western University. Right now I'm still at my practicum, and sorry for being late because today I'm a little bit busy. The reason why I'm interested in joining this organization is that I want to have more experience in public health, because right now I don't have a lot of experience, especially in Canada. I'm also an international student, so I'm really interested in working in public health field in Canada, and also I'm interested in global health. Thank you.
Thank you. Amani.
Hello, I'm Amani Hamadi. I live in London, Ontario, did my undergrad here at Western as well in criminology and business. Yeah, so did the Master Public Health program, and global health wasn't really covered in depth. So that's why when Chloe had mentioned Pegasus and global health, it piqued my interest. So I decided to join in and see what I could learn, and networking is important. So here I am, and see if there's anything I can offer, any knowledge or experience. I'm currently doing my practicum as well with chronic kidney disease and weight loss management. Not sure if there's any relevance here, but maybe there's some connections, but very excited to meet all of you, and thank you for having me.
Thank you, Amani. This is really, as Neil mentioned, I think Gertrude mentioned as well, it is very much an interdisciplinary team, and we work towards interdisciplinary work. We want to be able to inform, whether it be policy, education, research, and such from various points of view. So very much anything you can bring to the table or anything you can learn is obviously it brings something is what I'm trying to say. I don't know if Azra, I don't know if you're, I know sometimes you're in the hospital or you're doing different things, and I know you've introduced yourself before, but just so the other members can get to know you, I don't know if you're able to open your mic and give us a quick intro.
Hi, everyone. It's really nice to be here today. Thanks for having me. I'm happy to be here to learn and grow. My background is in biochemistry and psychology from BC. And I'm also doing my Master's of Public Health at Western with the rest of the team here. And my interest in public health and especially global health is within, so I'm an international student or was an international student from India. And I'm really interested in Indigenous health as well. So I think this will be a really good learning experience for me to understand further what Pegasus Institute has to offer.
Thank you, Azra. My bad. Different Azra. Too many guns jumping around in my world of going from different networks and different jobs and such. So my apologies. I see Robert has signed on, so I'll give Robert just a quick few minutes to introduce himself as well, if you're open to that. I know you just signed on.
Oh, hey, Chloe. Hey, what am I introducing? Myself?
Yeah.
Oh,
we have
yeah.
a few new members.
Oh, yeah. Okay,
a few
then
quick words.
hello. Welcome. My name is Robert. I'm a recent graduate at Wilfrid Laurier University. And I'm affiliated with Dr. Arya's research, and I support the website for global family medicine and other research projects that he may have, and some ancillary stuff that pops up now and then. I'm happy to be here. I don't want to take any more time. Chloe, you got this.
Thank you, Robert. It's actually, I'm actually just going to pass the torch over to Gertrude, who will start her presentation. Feel free to ask any questions or in the chat or live or anything, but go for it, Gertrude.
Thank you, Chloe. And yes, feel free. And Chloe, just let me know if somebody has a question, so I won't be able to see. The mess that is my desktop. It's okay, I'll share. Are you able to give the sharing capabilities, Chloe?
Absolutely. I knew about this too. I don't know why I didn't.
It's okay.
Give me 2 minutes while I try to figure this out. You know what? I will share the screen if that's okay with you.
Oh, but that's no problem. Yes, that's perfect.
Perfect.
You have the link, correct?
Yes, I believe it. If you did not change anything,
no.
Then I believe, or it would have changed in the presentation anyways. Do you want me to start from the beginning or from?
Yes, we'll just click through the slides. I think we've
Okay.
already done some of them.
Perfect. Okay, can everyone see my screen?
Perfect.
Awesome. So just let me know when to click through and I will click through.
Perfect. So as all you know, this is the Emerging Leaders Network meeting, and so we can do next slide. I have to follow my own slide. So I think we've already started with the agenda, introduction and icebreakers, Pegasus Institute. So maybe we can go down to maybe slide 5. Just a quick synopsis. I know we talked about Pegasus, but just in formal terms, our vision is we envision a world where peaceful interactions provides for sustainable global health. And our mission with this organization is to promote equity, justice, global health in its nexus with peace, environmental sustainability through the interactive fora to share research, education, field experiences, advocacy, and policy. Next slide. So all of these individuals are who make up the board of directors. As you can see, where Chloe and I and Innocent fall, but these are just some of the members that are part of the organization. And further along, I will speak a bit about the engagement piece and how they would like to engage with the network, and if we can get your input on what you would like to know from them. Next slide. In the next slide, this is just an organization structure for you to have a sense of how the organization is. So as a board of directors, Innocent is part of the advisory board. And we have a finance committee, which we fall kind of in between. I'm more so of a treasurer. Our president is Neil, Melissa is executive director, and Camille, who's joining, is the events director. And as you can see at the bottom, we do have quite a bit of networks. We have the events committee. The one that's kind of closed off, we're changing the name obviously to emerging leaders. We have communication and social media, which I believe Robert is part of. The Francophone network has mentioned, as well as we have a Latin American network, which both are quite active. Next slide. Some of the core activities for you to get a sense of Pegasus, we do interactive events, we do research and policy, and then we have education activities, publications of information, and supporting advocacy. And so currently in the interactive events, we host virtual roundtables. And so far last year, we facilitated 13 virtual webinars. So this is the general Pegasus Institute. And given that we have your contact, you'll be getting kind of emails if you'd like to join. And those usually showcase research and kind of works that are going with our colleagues across the world on what they're doing. And so you guys are welcome to join. We are developing 2 research projects on Indigenous policing and environmental toxins, which are still ongoing in terms of getting approval for those. We have the experiential learning opportunities. As Neil mentioned, we have a retreat for our members kind of later on in the year. In this year, we're looking at some sort of publications and supporting advocacy. And next slide. So this is just a general kind of Pegasus, and now to go a little bit more on the network. Next slide, please. Sorry, next slide, Chloe. Perfect. So the Pegasus Emerging Leaders Network, which we are part of, we aim to engage diverse individuals interested in addressing planetary health challenges for the promotion of peace, global health, and sustainability. Our objectives with the way we run our meetings are threefold. We want to have meaningful engagement. And so even though it feels a little formal that the way we've started, we hope that it's informal enough that you feel welcome to join in and jump in anytime. We are hoping to also build on your capacity. And so with that, given kind of the breadth of knowledge and wisdom that we have in the executive board, we just implore you guys to advocate for kind of the skills that you need and kind of the networks that you're hoping to develop. And with that way, we can kind of see who's the most appropriate mentor and see if he or she can join our meetings to support that. And networking, of course, as you know, the Canadian landscape is quite small. And so we will end up knowing each other for a very long time. And so such networks are great opportunities for peer-to-peer learning. Next slide, please. So with this meeting, we've already done the objective. I'll do my presentation and maybe a small piece on upcoming events if Melissa is on. So my presentation is building a career in global health, from internships to working with World Health Organization. And next slide. A little bit about myself. I'm a public health professional. I'm a certified PMI project manager. I love to travel. A yoga student, and I'm a car baby. That's the way to my heart if we ever meet. Next slide. So an overview of this presentation, I just kind of want to walk through kind of what we know and build upon these 3, I hope, pillars that we can all agree on. We can all agree on that whichever role that we do have postgraduate studies, there are career competencies. But with that being said, we know that having a degree is not enough. There's a lot more aspects into getting your foot in the career. And for me, what I have found to be very helpful is finding a way to stand out from the crowd. And so I'll kind of go through those 3 points very quickly. And next slide. In Canada, as many of you guys are in the public health program, you do know that the Public Health Agency of Canada, as part of the program, has some standards that it has set for all schools across the board of the skills that they require us to have on the way out. And those skills, just to refresh, fall under 36 core competencies, and those competencies are divided into 7 categories. All my presentation, which we can send along, have sources at the bottom, so you can kind of pull those and just familiarize yourself. But they fall under kind of public health sciences, which includes key knowledge and criteria and critical thinking skills related to public health sciences. We have assessment and analysis, which describe competencies needed to collect, assess, analyze, and apply information. Further, we have policy and program planning, implementation and evaluation, and this describes the competencies needed to effectively choose options and to plan, implement, and evaluate policies and programs in public health. This is more so where I have fallen over the years. And I'm pivoting to partnerships, collaboration, and advocacy, which looks at the competencies required to influence and work with others to improve the health and well-being of the public through the pursuit of a common goal. We have more so that has been coming to light, the diversity and inclusion aspect, which identifies the social cultural competencies required to interact effectively with diverse individuals, groups, and communities. And further along, we have communication and leadership, which I think are more self-explanatory. Next slide, please. So in understanding that a degree is not enough, we need to then ask ourselves what else is needed. In my opinion, I think there are kind of 3 core things that are needed: an online presence, strong professional networks, relevant intercultural exchange. And in the links that I've provided, I believe in the LinkedIn one, it just goes to show, there was a link talking about how important LinkedIn is for our kind of moving along in the future, and kind of the benefits of having LinkedIn, and kind of what is needed to have a proper LinkedIn profile that is searchable and user-friendly. So please check out this links once I send the presentation. And so next slide. Oh, so for me, I'll be focusing on the relevant intercultural exchange. As a person in global health, that's what's been the key for me. And so in Canada, in looking at intercultural exchange, you can look at the local level or the international level. In trying to make this more practical versus just spewing information, I try to find organizations that I think would give you the intercultural exchange from the local perspective. And so we have got Timovic, which I'm not sure if all of you guys know. It is a Canadian national youth empowerment and youth development charity. And its purpose is active volunteerism and to support communities. And so currently, at least by last month, they had registration for their 2 projects that they run this year. There's also a website called Charity Village, and Charity Village is an HR partner for recruitment in the Canadian nonprofit sector. It currently serves over 170,000 charitable and nonprofit organizations across Canada. They offer paid positions and free volunteer and event listings, as well as nonprofit and charitable sector resources and e-learning courses. And so if you're interested to see what's there in your area, please look at that. And last but not least, LinkedIn. And it's LinkedIn, it could fall on both, and it has a network of 810 million members in more than 200 countries. And the link here is to Rock Your LinkedIn Profile course provided by the LinkedIn program manager in terms of how to make your LinkedIn profile really stand out. In terms of kind of Canadian opportunities that have external facing, most of them are funded by Global Affairs Canada. And so the 2 that I want to talk about is the International Youth Internship Program. This is the one that kickstarted my global health career. In, I believe, 2014, I was given an opportunity to work with World Vision Canada, and I ended up going as a monitoring and evaluation program manager to to Malawi. And what this program does, it gives organizations in Canada funding to support a new recruit that has just come to school. And it's part of Canada's youth employment and skill strategy. Of course, during COVID, these programs were kind of closed off, but in checking last month, they had already started re-engaging organizations in order to do that. And then we have kind of a project browser, and I'm not sure if you're able to show this link, Chloe. So this link is something that I found, and you can just, sorry, let me open it as well. Maybe just
Can you
click search
see?
for, yeah, was it search for
Yeah.
projects?
Okay.
So I just wanted to show you guys this interface. If you want to have an understanding, so if you kind of go down a little bit here, so this kind of filter shows you funding that is being offered to organizations and where that funding is going. And so if you just scroll up a little bit, Chloe, we won't click around, but just to direct people, you can kind of organize this by the end date or the start date and kind of see the partners. And what I usually used to do when I was in my job search is maybe the last year or so, I just click around every month to see what organization has been funded and what they've been funded for, because usually the funding comes out first. And then in about a month or two, you'll start seeing some job opportunities pertaining to that role. And so this is just to keep abreast about which organization is getting funding and what that funding kind of supports. And this is an interface that is publicly available. So please use it to your advantage. And even right now, if you maybe you can do, I would like to do, maybe let's just click end date and see kind of the other way, the arrow. Perfect. And so as you can see, these ones that are ending further along, most of them were funded earlier, so closer to now. And so if you kind of click on the climate investment funds, if you're more so inclined to environmental, and you can kind of click in and see what it's about. And then you can obviously search by the organization to see if they have any available postings. So that's just kind of how I was, just to have an understanding of what's going on in the Canadian sector. Thank you, Chloe. We can go back to the presentation. I won't take too long in that. Next slide. And so in speaking about my first internship, as I mentioned, I went through the International Youth Internship Program. Next slide. And I had the opportunity to work in a program called Machinga Starting Strong, which aimed to make measurable contributions towards improving maternal, neonatal, and child health, nutrition for 12,000 children under 5 and 37,000 mothers in Chambamposa and Chikeo in Malawi. And for me, it was such an eye-opening experience, because it's two different things. It's two different things to learn about how programs work on the ground and to actually see the implementation. But I think also for somebody of color, of somebody who is an immigrant to Canada, it's also very interesting to see, to be of the place, but kind of simultaneously not being of the place, and that kind of engagement with community members and how they take to you. And so it's always very interesting for me to have this conversation about being somebody of color or being an immigrant and working in development. And if anybody has any questions about my experience, I can maybe offer some. Next slide. So I'm not sure how comfortable or how versed you guys are in working with major organizations, but this is kind of just an overview of how they kind of showcase kind of the work that they do with the master goal and the various, I should say, technical approaches that they would call it in World Vision. And so I was under Malawi Maternal, Newborn, and Child Health, but of course there was an integrated of WASH and food security. And in most nutrition programs, those three kind of go hand in hand because they complement each other. A few learnings that I got and which are interchangeable in a lot of organizations under various names. Next slide. Is something called kind of a care group model. And these are usually used in organizations that are trying to have some sort of behavioral change aspect to it. And so the care group model, as it was in World Vision, was a group of 5 to 10 volunteers selected by community members to be community-based health educators. And each volunteer was responsible for imparting knowledge that he or she receives through kind of health promoters led training to the designated household. And so each person had maybe 10 to 15 mothers that they were in charge of, and those mothers had to go back to their communities and talk to maybe 8 or 10 households. And this is used usually for the multiplier effect, in which, you know, a small training can disperse very far and wide into very rural settings. And the objective of the care group model is to ensure that each project beneficiary, so every mother and child, if that's your target, receives frequent and timely health messages in order to promote desired behavior change, thus improving the status of children and mothers in the impact area. So I just, next slide as well. So these are just a few pictures of how the care group model goes. And as you can see, you can barely tell who am I in separation to those. And it was such a beautiful experience for these women to see that it's not always, foreigners that don't look like them who can be coming back to their countries to develop them. So it was such a good experience. And surprisingly, all of them claimed me to be their grandchild. So I'll take it. Second kind of aspect, next slide, of a few, next slide past this, of something that I thought was also really cool in my experience is kind of the community complementary feeding and learning sessions. And these were usually geared towards children who have mild to moderate malnutrition. And so the main thought was you'll have an impact area. And when you're looking at the health of these children and mothers in this area, you would find that even though they live in the same environment and have kind of the same limiting resources, you can find 1 or 2 households in which the health status of the mother and the child are much better. And so World Vision used this model in which they would get these women to come in and have feeding sessions. And so they will teach mothers in their community how, in using the same resources, would make, for example, more nutrient dense foods. And so it was promoting the use of locally produced crops. It was promoting dietary diversity. It was promoting proper food processing, preparation, and preservation, and it was improving feeding and care practices. And so it was almost a sense of peer-to-peer learning, but using the women in the groups to kind of pass on their knowledge of why their children is doing better. And usually it was something as easy as, oh, the mothers were adding groundnuts to the soups that they're giving the children, and that's more nutrient dense. Or they were they had chickens and they were giving the children eggs instead of eating the chicken and not having kind of eggs for the season. It was little things like that. And we were using that to kind of amplify the little change that they were making and how it was having a big difference in the health of women and children on the ground. And kind of last but not least, this is a concept that I'm sure you guys are all learning in some various way in global health, village saving and loans. And the basic basis of it is a group of women, let's say 4 or 5 of us, will decide that every month we'll put in $100 for this bank that we've created amongst ourselves. These are usually for rural areas in which the banks don't have an active role. And so every month, for example, I would know that I get $400, and that $400 is substantive enough for me to do something of impact in my household. And so women will get together, and every month they'll decide a set amount of months, maybe 12 months, and then have 12 women. So every month, instead of this woman saving for 12 months to get whatever she needs to get, she knows that in her month, she'll be able to, for example, pay for her child's school fees, will be able to buy school uniform, will be able to buy machinery, small machinery for her farm. And so it was just a way in which women could lend to each other. And it was usually by women, but it could also, of course, translate to men. And it was providing simple savings and loan facilities to these women who didn't have access to. So in my first experience, in just noting, having this opportunity to do an internship with the IA program through Global Affairs, I came back with quite a bit of skill sets. Next slide. Oh, sorry, Chloe, next slide. That's a village saving and loans. Sorry, can we just go back one more? So for example, just a quick example. So this woman right here, when we came to the village, she had used her round of funds and had gone ahead and had built this this cement building. I think it was a storefront that she was building, which is quite difficult to do so because each kind of component of these requires quite a large savings for the average farmer. And I believe in a span of 1 or 2 years, she was able to kind of build this by herself, which is very great. And it's not an opportunity that a lot of women have. And so these are kind of the life-changing modalities that we were seeing on ground. Next slide. So in talking about having a competitive edge, depending on kind of the on the opportunity you're presented or what you're able to take advantage of, it depends. A lot of skills that you get can be transferable to other things. So for myself, the task that I had completed, community mapping, project budgeting, identification and documentation of care groups, monitoring of project activities, evaluation and impact, strengthening local partnerships and report writing have served me well throughout my career thus far. And so for me, the note that I have is find very relevant and actually impactful opportunities. Of course, I know they're hard to come by. You know, it's not gone are the days of, and thank goodness, of, you know, going somewhere for 2 weeks and, you know, you have a vacation kind of attached to it and you think you've done good. It has to be kind of a reciprocal role. And I think with that, you'll get the most impact and you'll help improve lives, actually improve lives. And so for me, given the opportunity, these are some of the skills that I brought back and I've been able to leverage them for the jobs that I have thus far. Next slide. And this is just a picture of my time in Malawi. They had put me at the top there, sitting kind of with the chiefs, and these are all the mothers kind of there. And this is my office team in World Vision Machinga, where I was based. So next slide. So in addition to obviously finding something that can give you skills that are not provided in the traditional school setting, you also have to find a way to stand out from the crowd. And for myself, when I was in Malawi, my supervisor had made mention that he thought with my temperament and kind of the way I manage my own work, that he thought it would be good for me to kind of pursue and look into introduction to project management. And so, and just to kind of introduce what project management is, it has thus far been cited as one of the key skills needed in almost all job spheres moving forward, that and tech skills and more soft skills such as writing. And so I wanted to just give you a sense of what it was. And if you're interested, I can kind of walk you through the application process and the testing, which is a little bit tedious in it. Next slide. Let me actually, sorry, let me, if I may, let me just click these links. If you don't mind, Chloe, could you just click those 2 links? I think I had some relevant kind of information to share. Perfect. So that's a LinkedIn. LinkedIn did kind of a mapping of kind of the top skills that will be needed in the near future. And they had found the World Economic Forum, which is basically the thought leader of all economics across the world, did a study on the future of job report. And in the future of job report, if you click on that link, it's a little bit lower on the LinkedIn one, just a little bit lower, future of job report, just right there. It gave kind of an infographic of the top 10 skills of 2025. And under all of these skills, all of these fall quite in line with project management, depending on kind of your area of expertise, if you're in IT or in health. And so this is, I was just making the call that in my personal view, I find if you're deciding to do a skill set in global health, and you're not necessarily going the epidemiology route, which is much more analysis, and you're going some more so of the management of resources and the management of programs, I would suggest to look into doing kind of a certificate or even going so far as to get certified for project management, because you can always call on any of these skills as part of your new learnings. And so analytical thinking and innovation, active learning, learning strategies, complex problem solving, critical thinking analysis, all those lend themselves very well with project management. And it's quite a diverse field. And it's quite an active field. Especially if you get credited as PMI project manager, you have to keep up with PDUs. And those are kind of learnings that I think it's about almost quite a few hours that you have to keep up with every year. And so it keeps you on the cutting edge of kind of new resources and where things are going. So just something to look into. Next slide. So with that, I just wanted to give you a general sense in the most basic view of what project management is, so you have a sense of it. And so before we get to project management, just to break those two words down, a project is defined, at least in the PMBOK book, as a temporary endeavor undertaken to create a unique product, service, or result. And if you see those two kind of underlined words, temporary and unique, what I'm hoping it can differentiate in your mind is the difference between a project and operations. And so in many organizations, they have the daily workings that the funding supports, that's operations, and a project will be something completely different that will be funded by a completely different source. And at the end, you have a kind of an evaluation process, and it should kind of indicate a change in some sort of health status, which is the unique product or service or result. Next slide. And so under the PMBOK, they have PMI process groups, and these are very, very similar to the traditional sequence of how a project cycle works. And so there's an initiation stage, which is defining and authorization of new projects. There's a planning stage, which is developing the working scheme of the project, kind of the scope of work and the resources needed and kind of the timeline and milestones. You have the execution, which would usually fall in line. A lot of organizations like World Vision Canada this will be their operating bread and butter, in terms of coordinating projects and resources on ground and coordinating resources in home country. Monitoring and control. This is the measuring of progress against project plan. These two are generally the main roles of a project manager in terms of keeping things under what's required. And then the closing, which is generally the evaluation and the major report to donors, which in our case would generally be Global Affairs Canada. Next slide. And so in having that general understanding, I just wanted to open up and maybe posit a few questions and see what you guys think about it. I'm curious what you guys think, if there's a difference between a project, a program, and portfolio. And if anybody has any idea, they can just unmute themselves and say anything.
I'm gonna guess, I think a program is probably bigger than a project, or a program consists of more than one project.
Okay.
I don't know.
Yes, you're right. And what about a portfolio?
Maybe more than one program, just going off the same logic, but I'm not sure.
And how would the programs be grouped? How would certain programs be grouped under the portfolio?
So like my understanding of the word portfolio is that it's like almost a resume or a CV or a drawing of a certain person, but in this case, it's a certain goal. So let's say your portfolio is to end a disease in a specific country, then there will be certain programs that serve that goal. And within each program, there are certain projects to serve the program. Yeah.
That's exactly right. So a portfolio is usually, programs are grouped in a portfolio if they have a strategic focus. So which is exactly right. If the focus is, so you can have a health program, an advocacy kind of arm, and you can have an evaluation. They're all very different, but they could be under that. That's very good. Thank you. And I've already kind of told you the difference between project and operations. And so maybe how, in that sense, then how do you know if a project is successful? And then or if it's easier, how do you know if a project has failed? What would be the metrics that you think just generally across any project would be the metrics for those?
I'll take a stab at that.
Go ahead.
If you met the objectives of the project, yep, and if it failed, if you did not, I guess the complete opposite.
What would be the matrix of failing, do you think?
So not meeting the objective. So for example, say for a program that's trying to implement like weight loss, for example, and you want it to be patient-centered and caters to like a specific population. So if once you implement this program, do a pilot study, and then at the end, you don't achieve any of the objectives like weight loss,
Mhm.
I would perceive that as a failure. And then you
Mhm.
would assess and look at what happened. Where did we go wrong? Why did we not get any success from this
Perfect.
program? Yep.
Yep. I agree. Maybe next slide, Chloe. And so I believe Abdullah was quite correct in kind of how they feed in together. But to your point, Amani, what you mean is kind of satisfied key stakeholders, which would possibly be the scope of work, what you aim to do. But for me, the reason I'm going more so on the project management route is that the other two kind of metrics that I'm using are on budget, on time, and within budget. And I don't feel so far from what I've seen that global health programs really hold these other two to the same standard as they hold key stakeholders. And so as well, if the project is not on time, if you're meant to do something in 5 years, that should be a metrics of failure. I feel like in global health, we have the tendency of just moving the goalpost a little bit further down. Oh yeah, we wanted to do this by 2022. Oh, it's okay, we'll just move it by 2025. And in a lot of fields like business, that would be a huge cause of concern. And also within budget, right? As you know, in global health, there's so many funding of programs, and if you look at a trend, a lot of things have improved, but a lot of things maybe haven't improved. And I think, at least in my opinion, we need to be a little bit more critical about how the money should be reflected, the impact should be reflected on the money kind of put in. And so given that we are the new kind of face of global health, through the advice and assistance of people like Neil and Innocent, I'm hoping that these are kind of the metrics that if we are kind of trained to look at programs in that way, these are kind of the metrics that we will be more stringent on kind of moving forward. Next slide. So just to see if your temperament kind of matches, the PMBOK also suggests characteristics, skills, and competencies to be an effective project manager. And the 7 traits generally are enthusiasm for the project, and that can also be kind of the knowledge of the kind of sphere that you're talking about. Ability to manage change effectively. As you know, things are always changing, and you need to be adaptive to the situation. A tolerant attitude towards ambiguity, and this is very key in projects that are kind of overseas. You never know kind of what's happening. Right now in the project that I'm in, the Philippines just had a change in government. And so we are not even sure if the program is going to be greenlit with a new kind of the new administration. And so this whole team from Bloomberg and Resolve to Save Lives are traveling to Philippines to just have an interface with the government to see if universal health coverage is part of their kind of agenda. And so always be aware of things like that will kind of derail. Team building and negotiation skills in your interim team, but as well as key stakeholders, whoever they may be, your funders, people on the ground, a customer first orientation, and in our sense in public health would be a beneficiary first orientation. And so what is the actual benefit to people on the ground and not just to funders? Adherence to the priorities of the business, and in our sense would be adherence to the vision and mission of organization that you are part of, and a knowledge of the industry or technology. So those kind of are generally the skills that are purported to be to make a very good project manager. Next slide. Similar to last time when I did this presentation, it always seems like we have very little kind of time to do this. What I had originally wanted to do is, in my role, at least in where I am right now in WHO, I found that in the new programs that we have, quite a few people are having a difficult time kind of developing a logic model or a theory of change. I'm not familiar if you guys are informed of this. Maybe you can put your hand up in the reactions at the bottom, whether or not you're familiar with these two concepts at the bottom. So just for my, okay, perfect. Okay, great. Azra, I'm not sure. Perfect. Oh, this is great. So these are the new skills, not necessarily the new skills. These are the older skills, the foundational skills that you would need in any in any project that you're a part of. And it's great to see that I think almost all of you guys, and it's great to see that the Western program is that well-rounded. But just to kind of walk through, I don't think I'll need to give an example, but just to kind of walk through what a logic model is. Maybe next slide. So logic models can take different forms depending on the organization. This was mine at World Vision Canada. And as you can see, it looks very, very kind of crowded, but all the elements kind of remain the same, which is activities, outputs, outcomes, and goals. And so the activities are kind of what you put in. These are actions taken through which inputs, which could be financial, human, technical, material, time, and resources, are mobilized to produce a deliverable, which could be something like, training, constructing something for a project, for which staff can be held accountable, and which, when aggravated, produce outputs. And so outputs are tangible deliverables resulting from project activities. These include products. Maybe next slide, Chloe. So outputs at the bottom here, you can see the process kind of inputs, activities, and then outputs. And those are tangible deliverables resulting from project activities. This includes products, goods, services, and changes, such as pupils trained with increased knowledge and skill that aggravate and contribute to outcomes. And so when we come to the outcome model, we have short-term, intermediate, and long. Generally, projects, the immediate outcome that you get is considered kind of the short-term. That's what you would put in your yearly reports. Intermediate would be kind of the trend that you would see. Generally in Canada, programs about 5 years funded by Global Affairs. So yearly reports would be the short-term outcomes. Intermediate would be kind of the mid-range, in which you can see the change in whatever health status from the beginning of the program to the middle, or even sometimes to the end. And the long-term, sometimes organizations come back 5 or 10 years later to kind of see the long-term outcomes. And outcomes are what the project expects to accomplish at the beneficiary level. And so, for example, the use and knowledge of skills in actual practice over time, transportation of goods or constructed roads over time, and they should contribute to population level changes. And those can be looking things such as, reduced malnutrition, improved incomes, improved crop yields. And this, when aggregated, should at some point kind of be seen in the health monitoring kind of system over time if you have quite a big population. Next slide. And so what I had as an example is kind of how the development of a logic model, and this was an example that I was going to give. We were just going to come up with an example amongst ourselves and kind of work through what would be the resources needed, inputs, and then the activities that would require, if it's training of this, buying this, outputs, counts, how many people were trained, how many sweet potatoes were purchased, how many women got the funding that was promised. And then the short-term goal, the short-term outcome is, sometimes could be, how many people are trained, and then the short-term will be 12 women trained, or this women use this money to buy these amount of resources, amount of sweet potatoes, goat, or whatever the case may be if it's a nutrition program, and so on and so forth. Next slide. This is an example if you want to play around with it. It's an Excel example, but you should probably just make your own, as it will be the same sheet, and you guys will override each other, but you can have a look of how I've arranged it. And I think that's it for my presentation. Unless you guys had pressing questions, I can take them now. We can see if Melissa is on to answer any questions. So maybe I can open the floor to you guys in terms of, I see Innocent has a few questions.
Actually, Gertrude, I don't have a question per se.
Okay.
I just wanted to highlight the importance of ensuring the active participation of the beneficiaries, from the beginning of the cycle throughout the project cycle.
Yes.
It's very important they be part of even defining what the success means for them.
Yes.
Right? Yeah.
Yes. There's no quicker way to derail millions of dollars than not involving the beneficiaries from the beginning. And maybe just a quick point to that. in the beginning of the meeting, I had put in a few of our advisors and executive boards who would like to come and make a presentation of your choosing. And I had a meeting with Dr. Don Sutherland. He has quite an extensive history in global health, and he had an example of he did so more so from the medical field. He had various examples of how that is quite critical. And so if that's something you're interested in understanding that component, maybe we can ask him to maybe focus on that in his presentation. Any other questions or comments? Maybe I can then give like a little story. And then I'm always curious to hear your perspective of the story back to me. So as I mentioned in my first experience, I went to Malawi. I am of African descent. My parents are both from Kenya, but I was basically raised here. So I go in there being more so of a foreigner, right? You just can't assume because your culture is similar that it is quite similar. And it was so, I've never had the response for this. And I think it speaks more to representation in fields. And I had a little girl kind of pull me to the side. I'm one of the teenagers that we were talking about going back to school. This was like a lunchtime thing that I was doing. And she was just so curious. And she just asked me, why would you come back? And up until now, I don't know how to answer the question, because I can look at it so many different ways. Why would you come back being like your parents have made the decision to go overseas? You should be kind of looking forward or not coming back to the continent. Or why would you come back? Like, there's so many ways that I could have taken it. And up until now, every single time I think about when I want to go to development, I always remember her. And I'm curious, seeing as how majority of all of you guys are in kind of global health capacities, I'm curious what that statement means to you, because I've never been able to answer it up until now. I don't know what she meant. And I think I was too young to inquire about it, but the older I get, the more I'm always so curious about that response and the basis of that question. Maybe I'll pause it out to you guys. Maybe I'll pause it to you, Robert.
Dr. Omro?
Sorry? I can hear you. Yes, we can hear you.
Yeah, could you repeat the last like 5 seconds? My internet upstairs is not.
I'm just curious to you what that question means to you, and how do you feel it, if you reflect on it on your own career and what you want to do in global health, what would your response be to that in whatever capacity you're thinking of being in global health?
Could you repeat the question again?
Why would you come back?
From
like being a person of color, and I talked to a friend of mine in Pakistan, and she got similar questions, and I talked to somebody who was in Bulgaria and got similar questions. I think it's always just a conversation about, if you're in the developed world, what is your reason of coming back to improve the developing world?
I mean, actually I've traveled, never mind. But I mean, I guess my home is here. My home's in Canada. I'm more knowledgeable about the systems here in the developed world than in the developing world, but I have, how do I say, I have an interest in my own heritage, my community, my heritage, in, like I would say, Jamaica, to better that, because I don't know, I don't know how to describe it. Like I feel like I have a, what's the word? Not a promise, but a
responsibility, maybe?
A responsibility to take care of my people in another country that are struggling, right? There's no resources in any developing country are slim to none compared to those in the developing. And if you can move those resources over to those that are in need, right, those that are vulnerable, always, and it seems like it always gets worse for them, then you could be doing a greater good, if not, than just staying in the developed world. And I mean, you can still be improving the developed world, but you can do a lot more with your time in the global sphere
Mm.
and the global sector.
Mm.
But I'm still an undergraduate, so I can't really comment. Like you're a professional, I am not.
Maybe to switch it around, because you said something that was, and this is a conversation we were having in the student and young professionals. We were having a saying called GLOCAL. Why, as global health practitioners, do we go overseas when we have our own kind of issues here in Canada, right? We have quite a lot of injustice with the Indigenous kind of work. You know, we have right now inequalities with housing. It's a, you know, pertinent thing. And so what is global health in that sphere if your own backyard is lit on fire? Right?
Yeah.
And so I don't know, those are just thoughts what I have whenever I think of global health and what we're doing, and the role that we're going to play moving forward, you know.
Yeah, no, exactly. I mean, like it's more dire in like countries that I wouldn't say on the brink of collapse, but I mean, if the backyard fire analogy is good, but I wouldn't say like you know, Canada is experiencing the same what do you call environmental and political and social degradation that some other countries are due to, you know, things like imperialism and colonialism. So I don't know, it seems more prudent to focus your time and effort if you are amenable to global change for those countries and continents and regions that need it. I mean, it does take a village. I mean, I've heard that saying a lot, but
yeah,
wherever your heart lies,
should
it
go.
does lie.
Chloe, can go ahead.
Yeah, for me, and it kind of tags along what Robert was saying about I forget exactly what he said, but I'll explain it, and then you'll see where it's tied in. Apologies, my brain's like on and off and etc. So I think for me, where I started kind of really questioning where I wanted to go in my career, what I wanted to do. When I was studying in my undergrad, I studied environmental geography, and a lot of the classes I took kind of approached development in a critical way of like, what does it mean, development? Because the word development in a lot of ways means just the involvement of the Western audience and the Western perspective in the developing country environment. And so I wanted to kind of more so better understand what we meant by or how development works in developing countries and how it is approached, and more so again how sustainable development is approached, because you hear about the United Nations, the WHO Sustainable Development Goals, and everyone sees that in a positive light but never critically assesses those development goals. Of course, professionals do, academics do, but I mean more so in the, you know, when you just hear about the Sustainable Development Goals, you think of it in a positive light, whereas you want to also think about it in critical light, and and that's what Robert was saying. Apologies. In the approach of you know, you want to think like developing countries have colonial and colonial histories, and as much as you developing means, or in some way means releasing populations, I guess, from those colonial histories and improving those lives because of the colonial histories or what they've caused, you also don't want to, or development in some way means proceeding in a colonial way, if that makes sense. So I know that Neil has written a lot of books, and I actually have one in my room about it, and in terms of international development and international experiences, and approaching that in kind of a proper way of not going about it in that colonial way. And I was listening to a podcast the other day about decolonizing global health, and someone on the podcast, a speaker, actually said that they don't like that word, decolonizing global health, because the word itself, decolonizing and colonizing, has its own notions and histories attached to it. So then we should explain it more as like a removing white supremacy from global health. And then it's a little bit about what that means. So I think that's why I kind of approach global health and want to get into it. And it's more so challenging myself and challenging the notions behind it. I want to, if I want to do anything with my career, it's to improve the lives of people. And I think that is what interests me, and that is what motivates me, is the critical lens of global health and colonialism in global health and et cetera. And so that's obviously a very, very complicated thing to explain to a little girl. It's not something that you would give an answer that you would give to a little girl, but for me, that is kind of the approach I take. And I'm constantly criticizing, or not criticizing, but like looking at it from a critical lens and a different way of, and that's also why I enjoy global health, is because there's always these different perspectives that you can look at it. I'll end there. I apologize if it was a confusing kind of train to get to my point.
Yeah.
But for me, that's how I try to look at it.
Maybe I can give Amani, if you have any comments.
See, I've been reflecting on that. And again, I don't have any experience with global health, but if I were to be in your shoes and say I went back to Lebanon, where I come from, and they have a lot of turmoil happening right now, and they asked me like why, I think we have a moral obligation to an extent that because we take for granted what we have here. And I understand that we have our own issues and we should deal with that. But for example, if in my household, there's some dysfunction and there's a lot of problems that I'm trying to deal with, but my neighbor's house is on fire, for example, I can leave my dysfunction for the moment and go help them put that fire out, just so that we can get them back to like a level playing field. So it's like, I would tell her that, because I have the ability to come here and to hopefully help you build capacity. I don't think we should go over there and tell them how they should do things or give handouts, because handouts they're temporary. So I just, that's kind of what's been going through my mind as you were telling the story. And as I've been sitting here reflecting, I think that we can't just look at, we need to focus on our own problems. If we're able to help, even just for a moment outside of our environment, I think we should. Yeah.
Great. Maybe I'll pass it on to Suyi, if you have a comment.
Yeah, I think sometimes I have the same question with you, because I'm also Asian, a Chinese people, and now I'm still an international student, and a lot of my family immigrant to Canada. And yes, I always think about the same question. For me, it's like when you come here, and you definitely feel a lot the difference between a developed country and the developing country, and you gradually realize that this difference is not only because of the policy or the economic, like this, it's also about the culture, the history. So when you think about this, and when you know that when you have the feelings of helping the people, especially within the same background, like me. So I want to help them more, because I can have that synergy to helping like more people with the same background with me. So yes, during this time, I just want to maybe when facing a problem, our first thing is that in my culture, so how do I do to help more people? So this is my this is what I'm thinking of when I think of this.
It makes me think of a new concept that's coming in, at least in Canada. It's called Diaspora for Development, in which they try to get people of kind of the similar culture to go back and kind of support that, because they understand the nuances of culture and they understand the nuances of the experience. But very, very interesting. I know I'm missing Abdullah. Did I miss you?
No, I've honestly got nothing to add. I think everyone covered it. Yeah, thank you.
Okay, no problem. Let me just confirm. Okay. If anybody would like to maybe have one more comment, please go ahead. And Neil and Camille, please welcome to say something as well. And Innocent, please go ahead.
Hi, Gertrude.
Yes.
Really, these are very good discussions, and I guess these are to be continued, right?
Correct.
We can reflect on the question you posed, particularly from somebody like me who has been in global health for 38 years, who has grown up within the global South environment, and who is after retirement decided to come to Canada to join my family. So I could definitely say we are global citizens, right? And we have a responsibility to really shape the way things are being done, not only here but only back home, right? That's part of the responsibility that we have as global citizens. And when you bring it back to the issue of global health, I mean, health is a global public good, right? And everybody has got a responsibility to contribute, modestly, if I may say so, but we all have a responsibility to do what we can, wherever we can do that. So so I really like what you say, and I encourage you to continue discussing and see how you can best contribute, not only here in Canada, but also back home and elsewhere.
Thank you for those. Maybe Neil, we'll give you the closing remarks before we do action items.
I'm not sure Neil has access to a mic currently.
Oh,
I think
okay.
he's kind of, yeah, now
Oh,
okay. Like, he's kind of like, he has a phone, and then I'm not really sure.
Yeah, switches around.
Normally, yeah.
He's an active doctor.
Yeah.
Camille, do you have anything you'd like to add?
No, I've been enjoying the conversation and discussion and learning from everyone else on the call. I'm here as a resource if anyone ever needs anything. Yeah, so I'm just here learning like everyone else.
Perfect. Before we close off, if you guys could please just look at those 3 individuals. We'll try and get respective. So that's Dawn Sutherland, Dr. Mary Louise McAllister, and Dr. Charles Larson. In that order, just have a review of their resume. We'll see if we can kind of send it online and see kind of what questions you may have for them. And as Neil mentioned, we have a retreat coming up called Wolf Island, and the retreat will be more so an opportunity to have dialogue and engagement, but also an opportunity to kind of have a better understanding of Indigenous kind of issues. We have Indigenous artists who will be coming, but more so it's a space to commune. And similar to this, we have kind of, we are planning activities for the larger Pegasus, but we are hoping maybe to have an emerging leaders, maybe event or side event as well. And so we shall send those resources and kind of the times and those following this meeting. And also we may send a link. I'm not sure if you guys, is school over? I'm not even quite sure. January, February, March, April, May, June.
They're practicum now.
Practicum now, yeah.
Technically it's not over, but the course, the bulk of the coursework
is done, yes. So maybe we'll just, if you guys can say yes or no to maybe meeting in the summer or not, just to have an understanding of the curriculum that you guys are on. So please, yeah, in the next week or so, look out for an email, a detailed email from either myself or Chloe with kind of these updates and reminders. But thank you all so much for joining, and please pass it along to your colleagues if you think they'll be interested. My vision for it is I wish we were like together somewhere in like a coffee shop and just like discussing. That would be my way of having this meeting, but alas, it's still COVID times and we're far and far between. Thank you guys all so much. Thank you, Abdullah. Bye, everyone.
Thank you, Chloe.
Thank you so much.
Please feel free to message or email if you have any questions or comments or ideas or anything like that.
Everybody.
See you next month. Thank you so much.
Bye.
Bye.